Hello, this is procedure 30-1, instructing a patient how to do a clean catch midstream specimen collection. So first I would start off by sanitizing my hands and greeting the patient and introducing myself. And I would also identify the patient and explain the procedure. I would assemble my equipment, which in this case is a sterile specimen container, antiseptic towelettes, and also tissues. I would make sure to label the specimen container with the patient's name, date of birth, the date of the specimen collection, and also the type of specimen that is being collected, followed by my initials. So, first, I'm going to explain how I would instruct a female patient, and then afterwards, I'm going to explain how I would instruct a male patient. So, first, on a female patient, I would tell the female patient to wash their hands and open the towelettes and place them on top of the wrappers. I would I would tell the female patient to open the specimen container and remove the lid, placing it on a paper towel with the opening of the lid facing upwards. And I would also instruct the patient not to touch the inside of the lid or the inside of the container. I would tell the female patient to pull down any undergarments and sit down on the toilet to expose the urinary meatus by spreading apart the labia with one hand. So I would also tell the female patient to cleanse each side of the urinary meatus with the antiseptic wipe using a front to back motion and using a separate antiseptic wipe for each side when cleansing the area. And after using the antiseptic towelettes, to discard them in the toilet. And the reason I would tell the patient to use a front to back motion would be to avoid drawing any microorganisms from the anal region into the area that is being cleansed. And after that, after cleansing the muatus, I would instruct the patient to use a third antiseptic towelette to cleanse um, across directly across the meatus using once again the front to back motion. And I would instruct the patient to continue to hold apart the labia and to void a small amount of urine into the toilet. The reason why I would instruct the patient to void a small amount of urine into the toilet is to flush any uh, microorganisms out of the distal urethra. And without stopping the urine flow, I would instruct the patient to collect urine at least halfway to the midline of the container, and also in the process of that not to touch the inside of the specimen container because, like I mentioned before, or I didn't mention that before, but you don't want to touch the inside of the specimen container because you could contaminate it with microorganisms that are on the skin of your fingers. And once you don't, or once you're done with that, once you're done collecting the urine halfway in the specimen container, you would want to avoid the last amount of urine into the toilet. And once you're done with that, or once you're done voiding the last amount of the urine specimen of the urine, you would replace the lid on the specimen container, make sure it's nice and tight, and wipe the area clean and discard any tissues that you used in the process, and also flush the toilet and wash your hands. So now I'm gonna tell you how I would instruct a male patient when collecting a clean catch midstream. So I would instruct the male patient, to wash their hands and open the towelettes, placing them on top of the wrappers, and also to remove the lid from the specimen container and placing it on top of a paper towel. with the opening of the lid facing up, and also do not touch the inside of the lid or the inside of the container, and also to pull down any undergarments, and to stand in front of the toilet and to retract any uh, foreskin of the penis if necessary. Cleanse the area around the meatus and the urethral opening, wiping each side with a wiping each side of the meatus with a separate antiseptic towelette, and discard the towelettes in the toilet when you are done using them. Um, after after cleansing the meatus, you want to use a second antiseptic towelette to cleanse directly across the meatus, and also discarding it in the toilet. And I would tell the patient to void a small amount of urine into the toilet, and once you void a small amount of urine, you'd want to uh, collect a proper amount into the specimen container, which again it's like at least halfway. And also do not touch the inside of the container with any fingers or your penis. And once you collect at least halfway in the container, you would void the last amount of the urine into the toilet and replace the specimen container lid and make sure it's nice and tight. Dry the area or wipe the area dry and discard any tissues that you used in the process, and also flush the toilet once you are done. And finally, wash your hands. Um, Once I would also instruct the patient that once they're done, they could bring their specimen collection to me, and I'll handle it from there. And if in the clinic we were to uh, do the test, I would do the test and record the results in the patient or in the patient's medical record. My bad, and record the date and time of the test, and also the type of specimen collected, which in this case is a clean catch, and also if we weren't doing the test in the clinic, I would I would report or chart that it was transported to, or it is being transported to, an outside laboratory, and I would prepare the specimen properly to be transported to an outside laboratory accordingly to the procedure, and that would be it. Thank you.